Long Acting Reversible Contraceptives are also known as LARCs. These contraception methods are over 99% effective at preventing pregnancy. LARCs include the hormonal and copper intrauterine devices, often called IUDs, and the contraceptive implant. They are reversible and can be inserted and removed by a trained doctor or nurse. After removal, fertility quickly returns to what is usual for each person. They are widely used as they are convenient and don't rely on taking a daily pill. Although LARCs are the most effective reversible contraceptives we have to protect against pregnancy, to protect against sexually transmitted infections, it is recommended to use condoms as well. IUDs are small, T-shaped devices placed in the uterus. There are two types of intrauterine devices, hormonal IUDs and copper IUDs. They can be inserted any time, except when there may be a chance of pregnancy. Hormonal IUDs last either 5 or 8 years. Copper IUDs last either 5 or 10 years. Hormonal IUDs release a hormone called progestogen, which prevents pregnancy by thinning the lining of the uterus and thickening the mucus at the cervix. Copper-containing IUDs don't release any hormone and protect against pregnancy mainly by stopping the sperm reaching the egg. Copper IUDs can be inserted up to 5 days after a pregnancy risk as emergency contraception. Copper IUDs start working immediately, while hormonal IUDs work after 7 days. They are the popular choice because they are highly effective, usually easy to insert and remove, and there is no need to worry about taking a daily pill or remembering to get a prescription refilled. Hormonal IUDs make the bleeding lighter, and in the first 3 to 5 months it is common to have frequent light bleeding, so that after 5 months, most people have very light periods or no periods, which is safe. Copper IUDs don't change the timing of periods, but some people do experience heavier periods. People with painful periods often get less pain with the hormonal IUDs. IUDs are inserted through the vagina and placed in the uterus. Before the IUD is inserted, the doctor or nurse will check the uterus by feeling the lower tummy and inside the vagina. They will insert a speculum in the vagina to view the cervix, which can feel uncomfortable or stretchy. A local anesthetic spray can be used on the cervix to reduce discomfort. The uterus is measured, then the IUD is inserted. Pain with an IUD insertion varies greatly between individuals. The average amount of discomfort or pain is rated between 4 and 6 out of 10. It is usually recommended to eat and drink and take some pain relief before the IUD insertion. Cramping is common for a few minutes or sometimes a few hours or days after the insertion. Pain medication, rest and heat packs can be helpful in increasing comfort. A person should follow instructions provided and contact the clinic if there are any concerns. An IUD can also be inserted under general anaesthetic at some clinics. IUDs can be removed at any time. It is recommended to use condoms for 7 days before having an IUD removed to reduce the risk of unplanned pregnancy. The doctor or nurse inserts a speculum and holds the strings of the IUD to remove it. IUD removal is quicker and usually causes less discomfort than IUD insertions. A new IUD can be inserted at the same time as a removal, or another contraception can be started straight away. Like any procedure, using IUDs involves some risks and they may cause side effects. These are uncommon, but it is important to be informed. With hormonal IUDs, some people may get acne or experience mood changes or tenderness in the breast or chest area, which usually settle within a few months. The copper IUDs do not contain any hormone, so there are no hormonal side effects. In some instances, IUDs may come out unexpectedly, which is most likely in the first 3 months. Therefore, it is recommended to feel the strings around once a month to check the IUD. During insertion, there is a very small risk of the IUD going through the wall of the uterus. If this happens, the IUD won't work to prevent pregnancy, and the IUD needs to be removed with keyhole surgery. There is a small chance of infection in the first 3 weeks after the IUD is inserted. IUDs are very effective at preventing pregnancy, but if a pregnancy occurs with an IUD present, there is a higher risk of the pregnancy being ectopic. Ectopic pregnancy is a pregnancy that occurs outside of the uterus. It is recommended that a person sees a doctor or nurse if they can't feel the IUD string, have side effects, pain, or think they may be pregnant. IUDs are safe, effective, reversible, convenient, widely used, and are suitable for most people.